shore this up. And I can tell you from the outset, if you've joined me and suffered through any of the many webinars that I've done, I always talk about the Department of Labor is really working hard to help people get open and stay open. And that's true, partly through our outreach on some of these mitigation strategies, partly through some of the MEDC and economic supports that have been out there. We did a grant program within MIOSHA last fall and into the winter on PPE and other safety protocols. And, you know, we're really trying to focus on that. COVID creates the challenges, right? So one thing I always start off with that you're very familiar with is that while we're dealing with a lot of noise around COVID, it primarily continues to spread through those large respiratory droplets and aerosols we create. So if you've been following us at all, you know that we've done a lot of HVAC webinars. We launched a program last Friday and did a webinar yesterday for restaurants on a safer dining program talking about HVAC. We have a lot of information up that you can follow on that if you're interested in your buildings. As HR professionals, one piece I forgot to mention yesterday, not part of that program, is if you've been closed, if you've been really limited, don't forget about your water. When we get to a point where people are coming back in, the engineering types are reminding me every time I talk to them to remind everybody to be careful about their water, because if it's been stagnant, you get biofilms, you can, in some cases, develop Legionella. So it's, you know, just one other consideration that we have to make. So all of the rules and DHHS orders are built around the concepts of how this spreads, and that's to maintain that social distance, wear face coverings to pull that virus back close to us, and then practice good hygiene. We know now, as this has developed, that some of the early cleaning and disinfecting and some of those things, you can still pick this up from surfaces, but that is not believed to be a primary or even a very large percentage of the transfer or transmission of the virus. So really focusing in on those large respiratory droplets and aerosols. DHHS from the outset has been tracking workplace outbreaks. I know there's some discussion over what that means. Outbreaks means 2 or more cases that are linked in place and time, according to DHHS. So this isn't necessarily one person that failed your health screening that's going home. These are 2 people in your workplace that are linked, and it's believed that there was a possible transmission. Now, these numbers you're looking at here, I always take out the schools, colleges, childcare, nursing home, and jails and prisons, and I do that because there's a lot of non-employees in those numbers. So I really pick the industries where we're pretty sure that these are employees that are getting the COVID virus. So, you know, don't dismiss those other numbers, but that's the goal, and that's the point of this snapshot, is just to let you know they're tracking 196 ongoing outbreaks, 77 in manufacturing or construction. If you're in manufacturing or construction, I can assure you that both industries have asked DHHS and me about 10 million times to separate those numbers. It's the way they're reported, so they're going to stay together. And then 16 associated with offices. And I can tell you, having given a lot of presentations and been watching these numbers, that 196 is actually down a bit, and that's good. Offices in general have been relatively high all through the summer into the fall. They kind of bubbled up when everything did in early November. They've started to trend back down, but as you can see, the new workplace outbreaks reported on the 28th, office spaces as a workplace were higher than everybody else. So that's something we want to keep in mind, and I'll be talking about a remote work policy. And I always put on the slide, just for reference, we always talk about social gatherings and everything else. There were 3 reported in the week of the 28th. So when we look at workplaces, what that tells us is that what we already know, congregation is bad, separation is good. That's hard to do in workplaces at times. It also does not mean these workplaces made a mistake. You know, it means that workplaces are doing, and you're doing what's been asked of you, and that's reporting the cases to local public health. Social gatherings, a little bit harder to contact trace, so we may not be seeing the full picture of the numbers there. And we do know, as you know, COVID's not in the building. People bring it into the building, right? So again, I always try to remind everybody, an outbreak does not mean an error. So don't be afraid to engage with local public health or MIOSHA or whomever you need if you feel like you need some of those things. Very good news, and I know you all have been watching it. Our case numbers in Michigan are way down. Our positivity rates continuing to trend down. Vaccine rollout is continuing to increase, so that's good. And then watching this variant, you know, that's really what DHHS is looking at. And I can tell you that, we see the variant cases in Michigan. It's a little bit more difficult for them to test for that. There's a certain process that goes into it. So when you see it, I think it's safe to presume that there's more of it. We just haven't found it yet. So just be aware of that. It spreads easier and quicker. So as you know, MIOSHA issued emergency rules on October 14th. Prior to that time, they were using the general duty clause. So in the statute, there's a clause that you're all quite familiar with, I'm sure, that every employer has to provide a workplace that's free from recognized hazards that are or are likely to cause serious injury or death. Part of that was relying on CDC guidelines. Part of that was relying on some of the parameters of the executive orders. When that changed in October, we issued emergency rules. They look different though. And I'm sure that when you were transitioning, it was, you went from one that was very prescriptive to a more normal standard, which is more performance-based. And then, certainly DHHS does have some role to play in certain types of workplaces. It's a little bit different in like a, more concentrated factory type setting. But what I suggest is, get those emergency rules. We have a template plan available, I'll mention. Those are going to be static, at least until April 14th. When we issue rules like that, we have a 6-month period. When we get to the end of that 6-month period, we can potentially reissue those again, which would push us into October of this year. DHHS is going to be more variable. So as you know, you're seeing capacity issues and things like that. You're going to see those in DHHS. So once you're solid with the MIOSHA emergency rules, just layer in those DHHS variables as they might change. So things you all know already, you have to have a written plan. We have a template on our website for low and medium risk workplaces. That's the vast majority of workplaces in Michigan. High and very high risk workplaces are more connected to medical care and direct patient care of people with COVID and aerosol generating procedures. Manufacturing, construction, restaurants, bars, retail, all that stuff is going to fall into the medium or low risk category. And in that plan, you'll see where that differential might be. One thing that we do see often is that many employers are missing this. It's not, not the end of the world, but they're missing this. Within all of these plans, you have to do an exposure determination. Depending on where you all might work, you might be very familiar with this because depending on what types of things are going on, you may be doing this for certain types of jobs. Similar for COVID. You're going to look at your workplace, accounting department over there is probably low risk. High density manufacturing is going to be medium risk and things like that. You don't have to go employee by employee. You can do it just by departments. And that's just to make sure that you're aware of what additional steps you may need to take, masking requirements, that kind of stuff. You're going to have your workplace procedures. That's what you all do every day, so I won't spend any time on that. But one that we do see that people miss is the COVID coordinator. Within the rules, you need to have eyes on the ground. This doesn't need to be a manager or supervisor or anything. You can have multiple if you have multiple departments or areas. This is just your employee on the ground that's going to monitor and ensure that the protocols are being followed and kind of keep people in line and make sure that management's aware if there are challenges or people aren't following the protocols. I'm going to cover sick employees a little bit more, but you've been dealing with that all year, so you're pretty familiar with what you need to do there. And then make sure you're training. We've seen a small percentage that are doing all the stuff, but they're not training employees on what it means or how you spread COVID or anything like that. So HR professionals, elite HR professionals, you're doing training all the time, so I imagine you have this covered, but that's one thing that we see from time to time. Just a note here, and you'll have this slide that we focus a lot on DHHS's masking requirements. There are requirements in the MIOSHA emergency rules as well. Now, employers need to provide those non-medical grade face coverings. You can allow employees to wear their own as long as you believe they're sufficient. It needs to be that double-layered cloth, surgical mask, something like that. That's all fine. But you do need to provide those as well. And when we have this rule that we get a lot of questions on, so they have to wear those if they cannot consistently maintain 6 feet of social distance. If they're moving around in an area, probably going to be wearing face coverings all the time. And then if they're working 3 feet or closer together quite often, we see this more in manufacturing and construction where you're typically tooled up with somebody, as we call it. You may want to consider adding face shields. That's just gonna, cloth face coverings are about 70% effective if we're both wearing them, is what the scientists tell us. Adding that face shield kind of adds a layer, but as you know, you can't create an additional hazard. And I don't know if you've ever worn a face shield, but depending on the environment, they can fog up pretty quickly, which is gonna create an additional hazard, right? So it might not be appropriate, but just to consider that. And then you have to require face coverings in shared spaces. That's gonna be your cafeterias, hallways, meeting rooms, in-person meetings, you're going to be wearing face covering while maintaining that social distance. I would liken that to anywhere I could be and somebody's just going to come strolling by, they're going to be needing to wear a face covering. Now, I get a lot of questions, and I fielded a lot of questions about quarantine and isolation. So there's been some updates to the CDC guidelines. The MIOSHA emergency rules reference the CDC guidelines. So that's what they're going to be looking at. And as you know, the standard 14-day is still the best, but you can do a 10-day if you follow some other protocols. And that includes continuing that symptom monitoring for the 10 days they may be off. They need to continue that after they're back, wearing face coverings all the time, keeping separate from others. And it's because they can still develop symptoms within that period. Once they get beyond that, it's sort of back to normal. The CDC also allowed a 7-day with a test, but that required approval from local public health or DHHS. They've been looking at that depending on testing capacity and otherwise. They're not there yet that I'm aware of. So we're only using the 14 and the 10. And then we do have information posted in our FAQ on critical infrastructure. Certain industries have critical infrastructure workers, which do have a potential allowance for working if you are a close contact. Isolation and everything is going to be the same, but if they were a close contact, there are some parameters where that person can continue to work, and there's a lot of detail that goes into it. It's not just simply, hey, we're critical infrastructure, we can do this. That employee has to be critical to the function. Essentially, the process isn't going to work if they're not there, type thing. And then isolation, as you're all quite familiar, is 10 days since your last symptoms. Your fever's gone without fever-reducing medication. Other symptoms are improving. Some of those symptoms last a long time, taste and smell, some of those. So you're not really worried about those as much. It's those other fever, coughs, runny nose, all that kind of stuff that people might have. And isolation occurs even if you don't have symptoms. If you test positive for COVID, this is the process you're going to follow. Many employers, I get asked from time to time, are requiring a negative test to return to work. That's not recommended by the CDC, nor is it required by anything within MIOSHA. We're just simply following the time protocols. We get a lot of questions on remote work. I know this has been a challenge to some degree. There is a little bit of distinction between what DHHS has put out and what the MIOSHA emergency rules require. So MIOSHA requires that you create a policy prohibiting in-person work to the extent that their work can be done remotely, feasibly be done remotely. And that's just a written policy that basically says that. It can be right in your plan. You don't have to have a standalone document. But you should include in there which positions or classifications report for work and why, and the reasons that the work cannot be performed remotely. This policy is really focused in on more office-style environments. We understand construction workers, manufacturing workers, service workers need to be where the work is, and that's going to be either in the shop, in the plant, on the site, or whatever. This is more focused around all those other jobs that we can probably do remotely if we push a little bit, and making sure that we do, because as I mentioned, congregation is bad, separation is good. This is just an effort to try to keep more people out of the workplace. So MIOSHA is gonna, if they get a complaint, they're gonna look at your policy. If your reason that people need to be there is because I like my team around, that's not gonna work. If it's because, we understand some people need to be there, that sometimes that's where the database is. Sometimes, or we know somebody needs to get the mail, somebody needs to do stuff, right? You can have a skeleton crew in there running around and doing what you gotta do. And if you have tech issues, that's gonna be okay. You just need to make sure that you are aware of that and you've documented it. So some of the things we've seen, as you can imagine, this list basically runs the gamut, right? So we have a consultation program that's out there. It's a free consultation for what we call heightened community transmission risk places where it's proactive, they're just popping in. So those would be bars and restaurants, small retail, gyms and fitness centers. MIOSHA also has free consultation services for any employer. upon request. And they've been doing a lot of plan reviews in that side. With our proactive one, we're seeing some data come back on what consultants are seeing. It's not an enforcement tool, so they're fixing these things. But many places are doing the things they need to do, but they don't have a plan. You've seen a lot of citations come out because certain employers aren't requiring face coverings. We've seen a lot of those in construction, frankly. They're not requiring face coverings where you need them, where people are coming together. Quarantine and isolation is a challenging topic. I know it's challenging for you to manage. It's challenging for employees, and it's challenging to identify for us as well. But we're working with employers across the state and better understanding which one is which, when you do what, and certainly in that critical infrastructure space, it's made it more challenging. The remote work, we have office environments where, we're getting a little anxious to start getting back in there, and we're getting ahead of the curve, especially with the variant I mentioned. Cases are still high. Community spread is still quite strong. Vaccine rollout has been a little bit, it's growing. And then finally, the daily health screenings. You have to do a daily health screening that includes a questionnaire. Swiping in is not enough. If you have a policy that says, hey, if you by swiping in or badging in or clocking in, you're attesting that you're fine, that's not a questionnaire. That's just a swipe in policy. So you do have to have a questionnaire, and there are tools, free tools available to help with that. You can find all this stuff, guidelines to all, every industry that was named in the executive orders, general industry, if you're not one of those that was named. We didn't want to change that. We were looking for consistency when we moved from the general duty clause to the rules. In our Michigan.gov COVID workplace safety, we have videos, we have an FAQ on the rules, which is wonderful themselves. We have posters, we have other things that you need. We're updating there. We have alternative language pieces available because you do have to do training and posters in languages that are common to your workforce. MIOSHA created a hotline in May at 855-SAFE-C19. You can call, you get directly into MIOSHA. The average wait time's been about 30 seconds throughout this crisis to get in there. The average call length's about 5 minutes, depending on what you need. If you need consultation support, they will get you over to that. If it's an employee and they need to file a complaint, they'll get them over to that as well. A great tool. I encourage everybody to take advantage of it for a lot of these questions. A couple of links that you'll have, but the consultation program, depending on your industry, has been great success for a long time within MIOSHA. Consultation is not enforcement. So these folks are not there to find things and fine you. They're going to work with you to implement practices and protocols as required. You can use them for non-COVID stuff too. They do this all the time across the state. They do a lot of training and outreach, and definitely a great resource for all of you. And then we have other links on there as well. And one I want to highlight is when you think about that daily health screening, there's a free app. Some of you already have this in place, but the MySymptoms app was created by U of M and DHHS. It's free for employers. You sign up, you get an employer code. You give that to your employees. They can use their smartphone, tablet, whatever, to fill out the questions. Questions already in there. You'll get a flag if they have COVID symptoms. They'll get a flag as well. And you'll have a real-time dashboard that you can look at as the employer. It'll also keep the records for you. So if as you maintain those daily health screening records, they'll be right there in that site. And then, so I don't take up all of our time just yakking, because as you can tell, I'm getting good at it. One of the other pieces that was in the questions was any overlap with workers' comp. So in March of 2020, God, it's hard to believe it's 2021. March of 2020, comp put out an emergency rule. It still continues until this March on a presumption for certain types of workers that if they get COVID, it was work-related. Those are healthcare workers, correction officers, essentially people that are going to be in the face of people with COVID. So think of it that way. For workers in general, comp's not designed and intended to cover what the law calls ordinary diseases of life. That's the cold and the flu and all those things that are just part of being in a society. COVID is similar in that way, but certainly if an employee could prove the infection was from work, they may be able to file a claim, but it's a challenge. So quarantine period itself is not necessarily covered. because there's no illness. So, there's some challenges there. We've talked in comp a lot about what this looks like and what it means. I can tell you that we've received about, last report I saw was about 6,500 COVID-related workers' comp claims in 2020. And, to put that in perspective, that's a lot. That's a lot of claims. And we know that many have come from, prisons, those frontline workers that are right in the face, paramedics, nurses, you name it, where they're going to it's more than likely they are getting that. Now, the employer can still show that they didn't get it there and it won't be a comp issue, but, it's a challenge there. So with that, I'll stop there, Geraldine, and you can fire away.
Well, we had two questions on face masks.
Yep.
One of the questions is, are there required types of face masks? In the past, we were able to, people were able to wear scarves or bandanas. Has that been tightened down recently?
Yeah, the CDC continues to update their guidance on face coverings, as we call them. Masks, as you know, it's a different terminology, but face coverings and gaiters. So if they don't like and they don't approve of face masks that have, or face coverings that have the valves already in them to make it easier to breathe, because you could still expel the aerosols or droplets through those valves. If it's a gaiter type neck thing, they're recommending 2 layers of fabric. As you know, as you watch the news with cloth face masks, they're recommending 2 layers of fabric. Most people I see already with a cloth one already have the 2 layers, so I think that's more common. But we would refer to or defer to the CDC updates. Those are the only 2 I'm familiar with that where they're concerned about that. Bandanas, because they're usually single ply, may not be covering the nose, mouth, and chin tightly. You could still have some aerosols and droplets get out of there, but so that's where it's at, is that CDC website. If you just Google CDC recommended face coverings or something, it'll get you right to the link, and they got all these nice infographics and everything else.
Okay. And then one more question on the face masks. What are some steps retail businesses can take to more effectively enforce a no mask, no entry policy before the customer walks through the door?
This has been a huge challenge, right, throughout the crisis. And MIOSHA's opinion right out of the gate was when that was required. What was the first time? Probably June. I don't recall in 2020, but it's just a good faith effort, because similar to those face shields, you can't create a greater hazard for the employee, and in no way do we want employees standing out by the door trying to push people out the door, right? So it's the signs, it's the reminders, it's the employee being nearby saying, hey, you have to wear a face covering. I would encourage employers to have those signs, which you're required to have the no mask, no entry, or you must wear a face covering, I think is what's required. Reminding people, making them aware that you may have to contact local authorities. I mean, one of the, that's a hard one. And we get it. So what we would anticipate or expect is that you're just trying, and we do have an FAQ, I believe, posted on this question as well on what does good faith mean. And it basically means those things. You have the signs, you have the postings, you have a reminder. If you have an obstinate person coming in that just says, I'm not doing it, I don't care, we don't expect you to get into trying to, push them out, hold them down, or anything else. We want you to just move employees, away from that person necessarily, and then manage the best that you can. We're seeing stronger compliance now. I don't know what you're all seeing day to day out there, but as we kind of look across the state, when we do those consultations, we're seeing about 95% compliance in those businesses of masking when those consultants are there. So that's wonderful news. So hopefully that's going to become less and less of an issue. Probably we see it differently in different parts of the state though.
Another question just popped up. What is the acceptable number of people for indoor gatherings? In a manufacturing environment, we need to conduct our take shelter drills. We don't know how to proceed with this, completing these trainings.
So the DHHS order, which has a lot of capacity limits on gatherings, actually defers to the MIOSHA emergency rules. Recognize that those drills are important and that you need to keep those going. I think you would want to consider how I understand why you would do the drill with everybody, but maybe you would portion the drill. So MIOSHA is going to look at face coverings, social distancing, and those types of things. There's not going to be a specific number that says you can't have X amount of people, but if your take cover drill is, let's take 100 people and squish them into this very small room, you might want to figure out a different way to do that.
Okay. Thank you. Does anyone else have questions for Sean?
I saw one pop up in the chat that said our high-low drivers' glasses fog up with the face covering on. Very common issue. As you can see, I'm wearing my glasses and I understand fully. That's a challenging one. I've heard good success with some of the anti-fog sprays, not necessarily the wipes. The wipes probably work, but the sprays work pretty good to help keep that fogging down. And then face covering that's tighter around the nose can help that with more of the pinch, like you would see on a regular sort of dust mask or N95 type mask. I have one on my cloth face covering, but I can still get some fogging. So trying to, manage where that air is coming out can help, but it's not perfect.
Okay.
I have a question. Hi.
Hi, librarian.
Yeah, we use this for everyone. We share this account, but my name is Liz Kish. I work with Geraldine Klitsch at the Genesee District Library.
Okay.
And so we've had a staff question lately of, so we enforce if you don't have a mask, you need to leave the library unless you have a medical reason, right?
Yep.
But what if they're wearing a non-recommended mask? So what if they're wearing a single layer bandana, or what if they're wearing like a winter scarf instead of an actual, what we think of as a mask? Like, should I tell my staff to enforce asking those people to leave because those aren't recommended face coverings?
So I think it would be good to talk with those customers. So CDC does say, even though they may not recommend those certain types of masks, the only ones they sort of say absolutely not are the ones with the valves, because with the valves that they're talking about, it's a cloth face covering. It has 2 valves on each cheek, and there's nothing in there. It's just open. So it's not really a valve.
I don't really want to go.
Right.
Somebody's off of mute. So the valves aren't really doing anything, but CDC will tell you that some masks or some coverings better than no covering. So even the single ply gaiter, the scarves or whatever, if they were coming into work as employees, we would expect you to say that's not happening.
Oh,
but
yeah,
as
absolutely.
customers coming in, I think it's probably good to let them know that those types of coverings aren't recommended by the CDC, but I don't know that unless you are comfortable that they will respond positively or okay with that concept, I wouldn't push on it too hard, because again, you don't want to create a situation where it's important, but it's not, because they're wearing something, it's better than just walking in with nothing.
Okay, that helps a lot, because the workers who brought it up to us, they were like, should we be kicking these people out of the library? And that seems like pretty drastic when they are making an attempt.
They're trying,
to cover their
they may
face.
just not know. Yeah.
Right. So
Yeah.
maybe going from like an educational point of view. Thank you so much.
Sean, I wanted to ask you a question about, you said the anti-fog sprays.
Mm-hmm.
Is there a particular brand that works better than the others?
Not that I'm familiar with. I just have discussions across the state with various types of employers, and that's about the best info I get, is that the spray works well, the wipes aren't as effective. And that's, high density manufacturing to retail stores that I kind of hear those things.
Few more questions. Employee refusing to take COVID tests due to religious reasons, but must be on site. Is this protected?
So I'm going to give you the official government answer. We can't give legal advice. I will tell you that you can find information on the EEOC about if you are requiring the test, some exemptions that may apply. If you're not requiring it, that's a whole different analysis, right? So the EEOC put out a long guidance piece on COVID-19 vaccines, medical inquiries, all kinds of stuff that is very valuable for employers to check in with there. But that does lead me to a thought that I intended to talk about but forgot, is we get questions on vaccines rolling out, what's going to happen with the rules. So we know, and I think we could all agree, we're pushing for 70, 75, 80% of folks to get vaccinated. It's going to take a long time. And a couple of the vaccines, we don't know if you can still transmit the virus. Even though you probably won't get sick, can you still transmit? We'll find that out. We know that even pushing to those numbers, if we're requiring it everywhere, not everybody will get vaccinated. So we expect or anticipate the MIOSHA emergency rules to continue pretty much into the foreseeable future, regardless if if your workplace has 60% vaccinated or not. Those folks will still be required to wear face covering, social distance. Sorry about that. And those other things.
Okay. When an employee claims they have been in close contact, can we require some form of evidence or supporting documentation?
If they've been in close contact, they should be coordinating with local public health. And I do know that local public health departments across the state do have a form letter they send out when they identify those folks. As an employer, I don't really know. I think we've been asking, and I know that you've been doing this for the whole year, to be as flexible as you can, because this is challenging, and bringing people together is hard. So I would look for those other resources, perhaps their medical provider. A lot of times, I would hope that the contact tracers are the ones notifying them, and I think it might be easier then to verify if that's what you need to do. But I understand the challenge that you have.
We have a few employees who have been out on quarantine for symptoms or exposure several times. Thoughts on how we can address this? They state they have a cold or cough or have been exposed to someone who is positive.
Very challenging scenarios. It's the symptoms of COVID, as you all know, are very similar to symptoms of other illnesses. At this time, because COVID is so prevalent in our communities, and we know that the flu is not, right? Because of all these mitigation strategies, people being away from each other, everything else, the flu is almost non-existent this year, which is wonderful. If they have those symptoms, the rules, either DHHS or ours, are going to require that they quarantine or isolate. We don't have the ability to make a distinction between, until their medical provider does or they're tested, a distinction between a cold or the virus. And nobody has, unless you're tested, nobody would know, right? So we all understand that. Quarantine can continue. The way it actually reads is it's 14 days or 10 days from your last close contact. And that creates challenges in the household where, just in my own household, right? If my wife is sick and I'm taking care of her, my close contact's going to change every single day. So it's going to push that 10 days or 14 days out. And CDC has like a calendar thing on that as well. So I understand those challenges. I think continue to be as flexible as you can, recognizing that you have work to get done. Try to work with those employees the best you can. I always encourage employees to talk to their managers about all of this and make sure that that communication is happening. Everybody recognizes this is hard, but we can communicate our way through it if we make sure that we're being honest with each other and we're all headed in the same direction.
Thank you. Any other questions? Well, I have to laugh because you said, you mentioned that probably some of us have suffered through some of your webinars. We chose you for a speaker because even though this is a dreaded topic, you're very thorough and enjoyable to listen to, knowledgeable, And we appreciate what the state of Michigan is doing alongside with the CDC.
Well, thank
So
you
we
so much.
appreciate everything that you do.
Thank you. I appreciate it. Thanks for having me.
Thank you. Thank you, Sean. Thank you,
Thank you,
Amaya, for
Sean.
setting this up.
Thank you, Maya. Thank you, Sean.
No problem. Thank you guys for having us.
Thank you very much.
This is very
Excellent.
helpful.
Excellent, Sean.
Yes, thank you. Thank you.
Okay. So hopefully that was helpful for some of us, just reminding us what we need to do in the workplace. And some things that we really can't become lax on. I think a lot of our employers or managers are at this point where we're becoming more lax. And I liked the idea. I've got a better understanding of how the MIOSHA emergency rules work in relation to the DHHS rules. I like how they said that the MIOSHA emergency rules were stagnant or static until April 14th. So I was not aware of that. And I was a little confused every time I read something different about MIOSHA and the DHHS. We often wonder which one we should be following. So that did provide us with some guidance as well.
So when can we expect to get a copy of the presentation you just did?
If you do want a copy of it, you could send either Vanessa or myself an
Okay.
email, and
Okay.
then I'll forward it to you right when I get it from Sean or Amaya.
Okay, thank you.
And I plan on, I recorded this session. I plan on uploading it to YouTube, and I'll be sending everyone a link. So you can share it if you like, or because it's really great information. We want to make sure everybody gets it so we can all get healthy and stay healthy. Geraldine, you've done an excellent job here today. I thank you for hosting this session. It was excellent. You picked a great speaker. And I want to check with Katrina. Did you want to talk about anything, Katrina?
Good morning, everybody. I just wanted to say that it was great information. And like Geraldine, I too was confused a lot of times when you're looking at the CDC and DHHS. So that did bring clarity to me as well. Geraldine, you are not alone. I was feeling the same way. But the information presented today was very, very useful. And a lot of things that we are doing at the agency where I work, I was not in my head like, okay, good. We are doing this, we're doing that, we're doing this. So it was like, check, as he was going through his presentation. So again, wonderful job with the speaker today, Geraldine. And I miss everybody. Some people don't have their cameras on, I understand. But I miss everybody, and it's comforting seeing you all faces today. Thank you.
Thank you, Katrina. And Geraldine, did you want to talk about how people can get credits, HR credits?
Yes, also if you want a letter for your SHRM certification, let me know if you're still on the call right now. Just let me know right now. I know Trish usually gets one. Who else requires one? Is it Amanda? So I have Amanda and the girls from Security Credit Union. So I will get that out to you this afternoon.
Thank you, Geraldine. And one last thing I want to do, and if you have time to hang around a little bit, I'd really like to go around the room and hear your thoughts. How are things going at your organization? So if you could just say your name and your position at your company and how things are going. And also let me know what other type of presentation you're interested in. So I'm going to start with the librarian. I think you say your name, Miss Klitsch, as well as Geraldine? Same
It's
as Jeff?
Kish.
Kish.
So,
Oh,
yeah,
Kish and
I know.
Kish. Okay.
We get that all the time here.
very
Kish and
close.
Cliff.
Okay.
Hi, everybody. I'm really grateful to be here today because I love Sean Egan's webinars. Like Geraldine and I are always watching them, and he's super great. I mean, it's a super scary thing. We have a lot of really scared workers, and you know, him kind of bringing that optimism and clarity. I really appreciate it. Things are going fairly well at the library. We have 19 libraries that Gerald and I oversee. So we have a lot of workers. You know, we also, because we're all librarians and information and professionals, things can get really like, people can be very intense and detailed about, like, I mean, you guys heard my question, right? Like, what kind of mask should I kick someone out for wearing? So we, you know, trying to answer people's questions, make them feel safe in their workplace, but also be understanding of the people who are coming into the library has, it's been a challenge. But yeah, things are going fairly well, though. Hardly anyone has been ill that works at the library. And if they have been, they didn't get it from working here. They knew, you know, what other place they contracted COVID from. So I take that as a huge win, personally.
Good.
So thank you.
Thank you, Ms. Kish. And Jim McGinnis?
I was pretty impressed that we were able to get someone in Sean Egan's position to address our group. I let my chief financial officer here know we have 71 employees in 4 offices, and so we're always looking for information like this. He sent me a note. He was wondering if we could get somebody from the Department of Labor to address what appears, well, in general, just talk about how employers can work with their employees to get them to show up to work during the COVID crisis. If you compare employee behavior early on to what's going on now, many employers suspect that this is what we're seeing out. You know, we have over 300 groups that we work with. Many employers suspect that there is some abuse of COVID rules to not have to come into work, and some of them continue to get paid when they're not coming into work. So just things around that.
Thank you, Jim. That's very helpful. And I'm sure there is abuse in a lot of things we'll probably find out later. All right, Ms. Yacht.